Eric Baker, the naturopath from New Zealand. Thanks for coming back to my autoimmune series. We're talking about now the best kind of diet, or what are the best foods to eat if you've got autoimmune disease. Well, naturally, the best kind of foods will not be dissimilar to the ones I like people to eat when they've got a candida problem or SIBO or a bad gut problem. They are the fresh, natural, healthy foods. But with a slant in this case, where I'm going to recommend you look carefully at the inflammatory foods, A, and B, the allergenic foods. Because remember, we're dealing with an immune system that's wonky. Okay, we don't want to inflame the immune system further, so we need to take inflammable foods out, like alcohol, okay, like gluten, like breads, like wheats. Most grains should come out ideally from autoimmune cases, especially when we've got cases like Hashimoto's and celiacs, because these are 100% gluten-free diets. So your practitioner will know the ideal diet, otherwise you should be seeing someone else. She should know the ideal diet for the condition that you're going for. But if you look at conditions, for example, they all vary. You know, we've got 80 odd different autoimmune conditions, but the 14 or 15 I spoke about, the diets can vary between the condition itself. When we look at, for example, let's pick something like ulcerative colitis. Now, naturally, I would have still tested the patient, and I would have had a good look at the beneficial bacteria count, the dysbiotic count, the yeast count. I'd be looking at the immune panel, what the antibody secretory IgA is doing, if that's very high or low. So I'd be tailoring the diet a lot to suit that stool panel. So if there's very low inflammation in the body and the immune system is good and there is not a lot there in terms of bad bacteria, I may allow the patient more discrepancy in the diet. But however, if I've got a really bad stool panel with 4 candida species, high inflammation, I'll really tighten the thumb screws down onto that patient. But I would do that over a 2-3 week period. Remember, I work warm turkey, not cold turkey. I don't take things off people and dump them on crazy diets. I'd rather do it over a period of a few weeks to allow the gut to slowly acclimate and get used to that. All right? And it works quite well. So my predominant diet for autoimmune conditions would be allergy-free diet. So I would take certain types of foods out of the diet and then put them back in after a stool test had shown that we had a big improvement in gut function. I would slowly put those foods back in. So what would I take out? Probably nuts, like most tree nuts would be taken out of the diet. Dairy foods would be taken out, all cow products. Gluten and wheat, I'd take out oats, barley, rye, most predominantly. Now we're talking like seriously bad gut here, a person with a bad condition. So we make major change like that. But again, remember, we institute that slowly over a 2-3 week period. We'll take probably several fruits out of the diet, like oranges, for example. And I would be looking at a steamed vegetables, salads, partially some foods raw, and lean proteins. Those are the sort of foods I'd be looking at with a patient with autoimmune disease. And in many cases, previously I would used to do food allergy testing on these patients, but I found it of limited use unless they were highly reactive to certain foods. So usually with experience, a practitioner knows what foods he or she needs to take out of the diet and guide you through that process. But suffice to say, alcohol doesn't play a role in autoimmune disease, nor does takeaway food, soda drinks, ice creams, candies, sugars, all that kind of crap. That all needs to go, because that just builds a bad bacterial base, which often many autoimmune diseases thrive on that really bad dysbiotic base. Oftentimes when I get a stool test report back from an autoimmune patient, they'll have 3 or 4 plus dysbiotic flora, so bad bacteria and high counts. It's very rare to get a report back from an autoimmune patient with a very clean, healthy functioning gut. Very rare. You don't usually see it. So the diet needs to be fresh and clean and healthy. And that's probably all I can say about it. You can see a lot more on this channel regarding my dietary recommendations. Meat, eggs, vegetables, and yogurt, or the MEVI diet, will suit a lot of people with autoimmune disease. Egg seems to be fine, unless there's an egg allergy. Fish seems to be fine, are quite good proteins for autoimmunity, especially the fatty fish like mackerel, because of the anti-inflammatory components. The brassicas, because of how they have a protective effect on the liver, especially phase 2 liver detoxification. And then I'd be looking at high antioxidant foods, of course, berries, avocados, salmon fish, wild caught fish, free range eggs. These are all really good foods for autoimmune disease. Blueberries are usually really good to eat. Spinach is a good one. Avocados. I mean, you should know all these foods by now if you've watched my channel. But there you have it. Keep away from the crap. Catch up with me in the next video on autoimmunity. Thanks for tuning in.